Hello, my name is AK6 2018. A 35 years old woman with headache, subject fever and anemia. It is a 35 years old woman with fever, malaise, headache, and normocytic anemia. His symptoms were initially attributed to an outbreak of Crohn's disease, but rapidly progressive anemia was disproportionate to the gastrointestinal blue observed. The reticulocyte count was less than 0.5%, indicating the complete absence of bone marrow responsive to anemia. Given that anemia is the most important finding in the presentation of this patient, we will focus on the differential diagnostic indices or processes that causes hypoproliferative anemia. Definition: the anemia that are associated with normocytic and normochromic erythrocytes and a very long reticulocyte response are the so-called hypoproliferative anemia. This category includes early iron deficiency, acute and chronic inflammation, renal failure, hypometallic states such as viral malnutrition and endocrine deficiency, and anemia due to injury medullary.
Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. When we breathe, as our blood passes through our lungs, oxygen molecules attach to the hemoglobin. Then, the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia.
Application in medicine. The patient received a transfer of units of red blood cells and her anemia decreased transiently. However, despite receiving support and care, the patient had anemia and marked fatigue. He had a persistence of viremia by parvovirus B19, decreased with glucocorticoids, the treatment of choice for most patients with warm autoimmune hemolytic anemia. After consultation with the infectious disease service, treatment with prednisone was started. After 10 weeks, the patient's hemoglobin level, lactate dehydrogenase level, and reticulocyte count were normalized. Cons. Pro. It has no pro as anemia is an indicator of malnutrition and poor physical condition. The lack of iron in women between 20 and 49 years results from a decrease in iron during the fertile period. Cons. Feeling tired, preterm birth and low birth weighting at birth, stunted growth, low performance at school, low defense, pylor, headache, dizziness, tachycardia, and arrhythmias. Braille names.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has three main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid or vitamin B12, blood disorders such as sickle cell anemia and thalassemia, or cancer, aplastic anemia, a condition that can be inherited or acquired, and G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
In soil application in Ecuador, the prevalence of anemia among non-pregnant women, percentage of women aged 15-49 years in Ecuador was 2,400 as of 2011, its highest value in the last 21 years was 3,400 in 1990, while its lowest value was from 2,400 in 2011.
In this video, you will learn about anemia during pregnancy. In most pregnancies, your blood supply increases during the pregnancy to accommodate the growth and development of the baby. If your blood supply is low, then you are considered to be anemic or have anemia. Good nutrition is especially important during pregnancy to help produce the needed increase of blood. Vitamins help contribute to a healthy body and pregnancy. Smoking alters the absorption of nutrients and can contribute to anemia. Other factors that increase the risk of anemia include poor nutrition, low iron and vitamin intake, alcohol consumption, and certain medications such as anti-seizure drugs. Symptoms of anemia may include 1. Shortness of breath, weakness, fainting, or tiredness. 2. Pale skin or jaundiced, yellowish skin. 3. Possible changes in heartbeat. 4. Headaches or forgetfulness. And 5. Nausea or abdominal pain. What your doctor can do. 1.
Diagnose the disease by asking about your symptoms and medical history, performing a physical exam, and ordering laboratory blood tests. 2. Prescribe prenatal multivitamins with supplemental iron. What you can do. 1. Increase the amount of iron and folic acid in your diet. 2. Eat foods high in iron such as beef, liver, eggs, whole grain breads, cereals, and dried fruit. 3. Take iron supplements with vitamin C to help with absorption. Orange juice is an excellent source of vitamin C. 4. Do not drink milk when taking your iron pill. It prevents absorption of iron. And 5. Protect yourself from injury and bleeding. For more information on anemia during pregnancy or to schedule an appointment.
Conclusion. The hyperproliferative anemia is an alteration of the maturation of the erythrocytes and can be recognized through the red blood cell indicates. The examination of the peripheral blood or bone marrow. If the red blood cell counts have normal values, it is most likely a hyperproliferative anemia, which corresponds to less than 75% of the cases.
About 3.5 million people in the United States have anemia, making it one of the most common blood disorders. But what exactly is it?
Anemia is a decrease in red blood cells circulating through the blood system. It can become a problem because the red blood cells actually bind to oxygen.
Fewer red blood cells to carry oxygen around your body means less of the fuel that your cells and organs need to live. Anemia can be caused by several different things, but one of the most common causes is iron or vitamin B12 deficiency.
We find that a lot of times in patients who are vegetarians.
Another more serious cause, internal bleeding.
So for instance, if a patient has blood loss, maybe they may come in complaining of GI bleed. Young patients who still have menstrual cycles, they have fibroids, they can also have it. Patients who had surgery or some type of trauma can have blood loss.
The symptoms in either case are similar.
Concentration can be a problem, fatigue, lightheadedness, dizziness. Sometimes you can look into your eyes and go, oh, they look a little pale today.
And the treatment depends on the cause.
Patients have B12 deficiencies or iron deficiencies, then we can replace them with oral iron or we can give IV iron. If a patient has blood loss and they're complaining of lightheadedness and dizziness, sometimes they may need to be admitted and subsequently we'll give them transfusions.
If you're concerned about anemia, Moncrief says make sure you see your doctor regularly.
Most of us probably are fatigued, but if you just don't recover, if you're resting well and your sleep is good and you're still complaining of feeling fatigue, then you would probably want to be evaluated.
And if you have symptoms like fatigue that just won't go away, she says don't hesitate to make an appointment. Adam McCoy, CNN.